Hello everyone. Today, I'm thrilled to share with you the findings of my study on the impact of obesity on endometrial cancer, that is cancer of the womb lining, which comprises 94% of all womb cancers. Now, why womb cancer? Because womb cancer is the fourth most common cause of cancer among women in the UK. Astonishingly, its incidence has increased by an alarming 59% since the early 1990s, making it the eighth leading cause of cancer-related deaths among females in the UK. So clearly, this is a significant health concern. So why is endometrial cancer rising? One reason suggested is because of the rising rates of obesity, which has tripled since 1975. It is reported that being overweight or obese is responsible for 7.5% of all cancers, but for endometrial cancer, this risk skyrockets to an alarming 34%. This emphasizes the crucial role that obesity plays in fueling this form of cancer. So the next question is, how does obesity increase the risk of endometrial cancer? What we know so far is illustrated in these two pathways. The clockwise pathway on the right shows that obesity causes insulin resistance and thereby alters the levels of insulin-like growth factors. The anti-clockwise pathway on the left shows that obesity triggers the inflammation surrounding cancer cells, which alters the levels of specific chemicals called adipocytokines. Both the pathways together increase the risk of endometrial cancer progression by promoting cancer cell proliferation, protecting the cancer cells from cell death, and by promoting the growth of new blood vessels. So what is still left to be researched? There's a lack of research on insulin-like growth factors in endometrial cancer. Also, the complex interplay between the insulin-like growth factors and adipocytokines is yet to be explored. This brings us to the purpose of my study, which is to assess the diagnostic value of various adipocytokines and insulin-like growth factors by measuring them in the blood of patients with endometrial cancer and comparing them to control patients without any cancer. Additionally, I aim to correlate these markers with the cancer characteristics, the participants' clinical and medical data, and with measures of obesity. Excitingly, our initial findings have already revealed intriguing correlations between some of these markers, obesity, and the risk of endometrial cancer. Some also show potential as prognostic biomarkers independent of obesity. So what is the next step of my research? It involves examining the relationship between the levels of these markers in the blood and the tissues of patients with endometrial cancer. By shedding light on the hidden web of interconnections between these obesity-related markers and endometrial cancer, we will hopefully be able to develop more effective diagnostic and treatment strategies in the future. Thank you for joining me on this captivating journey of discovery and hope.